Thank you, Madam Acting Deputy President. And I'm pleased to be able to give the very first Senator statements in this place, given the new arrangements, to a topic that I'm certain will enjoy the support and encouragement of all sides of politics, regardless of our particular partisan interests. I rise, Madam, to speak about the advent of an initiative known in my home state of Queensland as the Heart of Australia. This project embodies the most innovative approach to frontline specialist medical services delivered in generations, specifically aiming to assist those Australians who are threatened by our nation's vast distances and access to medical facilities of a standard and of an availability that is taken by many in our nation for granted. This project, or this initiative, is the brainchild of Dr Rolf Gomes and his wife Kylie Gomes, and they've facilitated the establishment of the nation's first mobile specialist cardiac health service clinic. Whilst this is unique to Queensland, I fully anticipate that this project will operate in some ways as a pilot. I know that it has attracted great interest across our nation, and I expect that health professionals all over the country and those who are responsible for the development and implementation of public policy will be watching this initiative very closely, in order that it may be duplicated not just in the delivery of services to do with cardiovascular disease, but indeed a very wide range of medical services that can be delivered remotely with the right amount of planning and support. Madam Acting Deputy President, millions of Australians are affected by cardiovascular disease. It's rated as Australia's biggest killer, and at any time is affecting the lives of up to 3.5 million Australians at any given time. One of the tragic statistics, however, that goes with cardiovascular disorder is that if you live in rural and regional Australia, you are more inclined to be affected by the disease by about 15%. Now, this is a very significant variation, and one that ought to remain as a serious concern to all of those who provide, again, the development of or the implementation of health policy in our country. If you go to our Indigenous communities, where communities clearly that are predominantly the inhabitants are our Indigenous Australians, then of course this figure with respect to cardiovascular disease increases once more to levels that I say we should all be embarrassed about. So people living in rural and regional communities, Madam Acting Deputy President, have less access to many critical services in health, and particularly in the area of health. People in regional, rural, remote areas of Australia experience poorer health outcomes than those living in urban areas on just about any test that is applied. Life expectancy in regional areas of our country is 1 to 2 years lower, and for remote areas up to 7 years lower compared with the average in our major cities. Now, these stats are of course compounded by the fact of people who tragically lose their life to trauma injuries, where because of the remoteness or distance or availability of services they don't get that critical treatment within that important time span post the event. People in regional, rural and remote communities have limited access to primary health care services and are more likely to be admitted to hospitals for conditions which could have potentially been prevented through the provision of non-hospital services and care. In my maiden speech to this place Madam Acting Deputy President, I made clear the point that over decades, and I was quite specific about my home state of Queensland, but I'm sure it applies equally to most of the rural and regional areas of the country, where through the economic rationalist policies of many administrations, and I think I commented at the time that bad policy has no respect for the political incumbent, so it's been decisions taken by governments of all walks of life. We have reduced all level of services in a very critical way to many hundreds, if not in the thousands of our small communities across the country. Over time we reduced their access to, we closed their courthouses, we closed and pulled up the railway lines, we closed the schools, and at that time we gave licence to the private sector, banks, real estate agencies, stock and station agencies, all to leave these small communities and districts. And of course one of the most critical things to leave was the provision of health services. And indeed there are many dozens and dozens of small communities in my home state where women could once go through the confinement of preparing for delivery of family members, and could indeed, the children could be birthed within those communities, and now that's not the case. In fact, many of those communities that at one time were properly staffed with health professionals now have none at all, and it means that people's in those small communities, and as importantly the very big districts that they service, now have to travel hundreds and hundreds and hundreds of kilometres to get simple primary health care, such as the setting of a broken bone or some other treatment that might be critical to their condition. And so it's within that context that I have been proudly, along with quite a number of others, supporting Dr Gomes in his initiative to introduce the Heart of Australia. It is a super innovative project that includes a massive trailer. It'll be of interest to you. Senator Stirl, I understand it's the longest, at 29 metres, the longest trailer to be commissioned to go on the road at the launch, which occurs on Friday morning in my hometown of Toowoomba. And I'll proudly be representing our government and the Parliament generally in the launch of that. This service will take cutting-edge, state-of-the-art cardiovascular diagnostic equipment to all of these small regional and rural community hubs. And so effectively now an individual who may have taken weeks upon weeks upon weeks to get referrals and be taken away out of their community to larger centres like Townsville and Brisbane in the context of Queensland, will now be able to have these tests done right there, right at home, one block from where they live if they happen to be in the small communities, or whatever that drive is that brings them into these critical hub centres. There's evidence that many people on the land, and we're talking now just in the context of cardiovascular disease, often put off tests. They put chest pains and chest pressures down to strains from work, or they just took the gamble that they would wait until the shearing was completed or the mustering was done, or those heavy chores for people who are struggling on the land, before they might go in and have their check. Well, as of Friday, that all changes. They'll now have regular and very accessible opportunities for their GP to refer them to this mobile clinic, for want of a better description, and if their condition, their cardiovascular condition, is one of a serious nature, of course traditional methods to uplift them and to get them away to where they can receive that immediate treatment that they require, that life-saving treatment will be available. So I commend to this chamber and to our government generally, and I'll be seeing that my government in particular pays close attention to observing this pilot, this trial, the implementation of this service, because I think it has enormous application. And I wish to close by saying that I think in the fullness of time Dr Rolf Gomes will be recognised as a pioneer in this very important space.
Senator Singh.